Welcome back to The New Norm. I'm Dr. Lou Graham, and this program is brought to you by Midway Dental and Catapult Education. So, the news today, just briefly touching on it. Anthony Fauci says that based on how we're kind of going, if we loosen up a little bit, we can expect maybe a second or a third or a second/third wave. I think we all kind of know we're not through the woods with this. And on the other hand, we all want to get back to some normalcy in our lives. And I think the reason why I started the show off with what Dr. Fauci is talking about is it's all about us being prepared as a profession. And I think prep is really key. So yesterday, or the one or two sessions ago with The New Norm, we had Amber Auger on. She is a dental hygienist. She was fantastic talking about really the new norm in hygiene. And one of the products we touched on that she loved was Dentsply's Purevac system, which unbeknownst to many dentists, including myself, that has been on the market for a number of years. Okay, so as a profession, where are we? I think as a profession, we all want to start getting back to work just in a safe environment. Dentists are doing emergency work, or many of us are. I've got 5 patients tomorrow. That being said, how do we move forward? We need PPE. And I know as part of Midway, PPE is a huge issue. We've got to get enough of it out there. Still have hospitals who need it and primary caregivers. And now I think the next level hopefully will be dentists and other caregivers. So I think as we move slowly from emergency dentistry into maybe elective dentistry or emergency elective dentistry, I think then the next tier, and it may be a month away, will be hygiene. And as Amber and I talked yesterday, and can't wait to talk about this with Meagan, is really safe hygiene, because this is a big concern, as it should be, because per the CDC, hygienists with aerosol and ultrasonics, it's a number one issue for them, and number one issue for our offices. So with that being said, I want to introduce Meagan DeLawder to us. So Meagan walks the walk. So a little background, okay, she doesn't know this. So I've known Dentsply. We've had great relationship for 20 plus years, and a couple of my, I'd say, buddies there, Steve reached out with Ken, who I've known also for years, about this product. And I go, who should I interview? And it was Meagan. Everybody was unanimous on Meagan. So who's Meagan DeLawder? So hygienist for over 10 years, worked in sales at Dentsply over 10 years, and now she's really a preventative specialist. So I talked with her earlier, maybe this week, last week. I can't even remember the weeks anymore, like all of you. What day is it? And it was great. So I want to share why Purevac, why I think this is a really interesting product, and why I think this is part of the new norm of hygienists getting back to work. Meagan, welcome to the new norm.
Thanks for having me on.
Our pleasure. So let's come from the hygienist world and prevention. You hear all the concerns out there. Why don't I hear from you? I've talked enough right now. What are you hearing out there as the concerns from the hygiene world?
I'm absolutely hearing the same things you are, that hygienists are nervous about going back. They're trying to figure out the best way to stay safe for themselves, as well as provide safe treatment to their patients. They don't want to go back to hand scaling either, because that doesn't really help a lot of people out there. So they don't want to provide, subpar clinical benefits or outcomes to their patients.
Right.
And they want to figure out what is the next step, what is their post-COVID type of treatment look like, and how they can best, enable everybody.
Right. And on the town hall yesterday, I was fortunate enough to have Tracy Whale on, and she had a great pearl. This is a great pearl. So if a hygienist goes back to week, and let's say a hygienist is working 4 days a week, she would have 4 N95s or KN95 masks. And with her recommendation was still to use a level 3 mask over the KN or the N95. Yep. And I know a lot of people out there don't like, this is not Lou Graham's view. This is an OSHA expert after OSHA expert's view. Don't hate Lou Graham for this, but I thought here was her pearl. when you're done Monday, take your mask and put it in a baggie and mark it Monday. Then you're going to get your next mask, and that'll be Tuesday's mask. And then it's Wednesday's mask, and then Thursday's mask. And by the time the mask comes back Monday, the virus should have died off, because they say up to 72 hours. And it's basically you're using Monday's mask, because PPE is going to be hard to get. It was a great pearl.
Absolutely.
I know, I thought it was a great pearl. Okay, so let's talk then about, we lived in a world that every hygienist was using a saliva ejector. You know it, I know it. And this product, Purevac's already been around now a couple of years. Now it's a hot product. Talk to me what's changed in these 2 years, specifically 6 weeks. What's going on with recommendations?
Yeah, absolutely. So we've always used that saliva ejector. That's like our main go-to. We learned in school, and I know a lot of newer clinicians coming out of school, they are a little bit more apt to use an HVE. We learned in school that was the correct way to reduce aerosolization, was to use an HVE. However, in the real world, it is so cumbersome. It is so heavy. It's just not conducive to what we're trying to do. We're trying to, have 4 hands going on with a mirror, with an insert, with suction. We're not an octopus, so we're trying to do too many things at one time. And there wasn't a great solution to provide the protection that we were looking for in aerosol reduction, but also with moisture control, because that's where we also want to make sure our patients weren't drowning as we were working as well. So that's where now it has changed, where we're looking at aerosol reduction as more of a pressing concern. But of course, don't want to make sure that our patients aren't drowning either, right? So that's where that Purevac HVE can really do a little bit of both, if you will. Still not asking a hygienist to put down that saliva ejector, because that's what a low volume evacuation or a saliva ejector does. It's made for moisture control, where an HVE setup is for aerosol reduction. So there are both worlds that need to kind of be tapped into to make sure that we're providing the best patient care, but also being safe for ourselves as well.
Right. So when we kind of went over this, and then I went on YouTube and looked at this, the fact that you have a really easy to install system into an HVAC, really easy with the tubing and the kit. The tubing seems uber flexible compared to the the tubing that my assistant would hold. So flexibility here with ergodynamics seems to also happen with this. Would you agree on that?
Absolutely, 100%. And the fact that CDC and ADA are both recommending that any type of procedure that produces aerosolization as well as splatter or spatter are their terms. It's not actually been a new recommendation. It's been one around for a long time. So being from the Cavitron world, with Dentsply Sirona, we wanted to create a way that we could give a hygienist the ability to have that flexibility with that hose and provide an ergonomic solution for them to be able to follow CDC and ADA guidelines, but also not want to, have to have a massage therapist at the end of the day, work on their wrist if they're trying to use that heavy existing hose that you just mentioned. So that's where that Purevac HVE is a huge benefit, just weight wise and ergonomics.
Right. So the way I kind of looked at this is, you see coming these new products, these extra oral vacs, they're bigger, they have these filters, they're coming, but yet this has like you had told me, an 8mm opening, easy to hold, very close to where you're ultrasonicking. I mean, what are the studies showing, or at least what is Dentsply showing as far as how much aerosol is this baby really getting a hold of? What are the studies showing so far?
Great question. And that actually goes back to that saliva ejector and that LVE. It does 0% aerosol reduction. So what we have currently been doing has not helped us at all. We're living in this like aerosol cloud. And some studies, what we kind of look at is an 8-foot cloud radius, right? So to be considered, and this is a Molinari study that he did, was to be considered a true HVE, you have to have an 8mm bore in that suction device. And you also have to be able to remove 100 cubic feet of air per minute. And so that's where that Purevac does still follow. And so when we do have that actual, HVE parameters around that, it's a 90% aerosol reduction rate. So that's huge. So if we're going from 0% of that saliva ejector to 90%, that's huge. And as far as extraorals, it's another layer of protection. That's kind of what we're talking about. But if we can have something that is direct and focused right inside or intraorally, we're definitely going to be, reducing that aerosol cloud significantly before it even has to hit an extraoral system.
Yeah, when I've seen this, it kind of reminds us when we got Isolite and Dry Shield into our practices so that we could work more ergodynamically, but also really protect the patient and suck up that aerosol. I mean, I look at this, I almost look at this that instead of the hygienist holding a mirror, which pretty much does nothing except hold the tongue out of the way.
Sure.
And the fact that this is fogless, I really see this and I don't say just, but I see this replacing the mirror so openly. It really doesn't add much more, I think, to the complexity of what the hygienist is doing. And you've used this, so what have you seen when you've used this? And your hygienist have used this?
Yeah, agreed, absolutely. The fact that it almost gives the hygienist an assistant, if you will, so that way they can use that mirror head for retraction. I know in the past where if you're using a regular HVE, that the suction tip itself it's pretty sharp, if you will, and so the mirror head being rounded is wonderful. So it's a better patient experience as well. You can direct a little bit better so you're not sucking up that side of the cheek or the tongue, things like that. So it is a nicer option than either the existing HVE as well.
And for the viewers out there, so when you get a kit, a basic kit, because I got one, I already have one delivered, you get the tube, it's an easy setup into the HVAC, and you get like 3 mirror heads, basically suction tips with mirror heads. And basically, the way I'm looking at this is as soon as you're done with one patient, that goes to the sterilizer, you load number 2. And so with 3 coming, I really see almost, am I wrong on this? One system per hygienist should last quite a while for that hygienist. Would you agree on that?
Yeah, absolutely. And we do have just the mirrors if they wanted to purchase extra, because it all depends on how often that autoclave is getting run. So we do have an option that they wanted to purchase like an additional 3-pack of mirrors, not a problem as well. And if they have multiple hygienists, we have a 12-pack too. So that way we can help out with that. But yeah, so as far as cleaning is concerned, it's really easy. I have been getting a lot of questions on, do we need to have a service tech come in and install this? No, absolutely. It's what I call plug and play. They drop down their adapter right into their existing suction, and they're ready to go. It's very, very simple. The mirror heads, they pop out. You can go ahead and put that in your ultrasonic bath, just like any other dental instrument. Rinse it off, bag it, and throw it in the autoclave.
So, and per what I read about it before interviewing you, you can get up to 100 uses per piece. So, I mean, technically, that could be up to 300 uses per that initial pack that you buy. So then you'd be reordering just the mirror heads, not the tubing. Is that kind of correct? Absolutely.
Yep. And we have it. It's warranted up to 100 autoclave cycles. So what we're saying is basically by the time that 100 autoclave cycles per mirror head, the mirror might get scratched just like any other mirror.
Yep.
So they're very, very affordable. And if you're only getting that 100, say it's 20 cents per use. So 20 cents per use a patient is significantly less than some of the other products in the market, but it's also 20 cents, So if we're talking about hygiene protection there, it's 20 cents. It's certainly something that is very, very feasible and economical for any office.
I mean, if anything, then the office can either add a minor addition as part of their PPE fee or their pro fee or 4910 fee. But again, this isn't thousands of dollars. I think it was like $199 was what I saw as the retail. And in all honesty, hygienists want to work in a safe environment. I really see this as a home run opportunity for hygienists to feel more comfortable doing the work. I would assume that's what you're hearing.
100%, because they're looking at ways to, protect themselves. And again, 90% of aerosol reduction, that's a huge percentage of what they are living in and how we can reduce that for them. And there are also wonderful opportunities too with this. I found it was great to be used for offices that are using a ProfiJet. It's wonderful to kind of minimize that mess. Because it's a wonderful device, and some offices are actually going just to air polishing versus rubber cup polishing. So this is wonderful for that. Yes. Or isolation when you're placing sealants. It's a wonderful option to have when we're doing sealant placements and we're working two-handed and trying to create a dry field environment to allow that sealant to last as long as we can.
Yeah, and even just the splatter if you are using a paste.
Absolutely.
I mean, you're right there, and splatter is also an issue.
It is.
So
And
yeah.
I'm going to say it absolutely is, and that follows that CDC and ADA recommendations of any type of procedure that creates that splatter. So even just a coronal polishing still needs to have this. So, and there are some states out there, I live in Pennsylvania, and we utilize EFTAs. And so EFTAs actually work two-handed as well. And so this is something that an EFTA can certainly take advantage of to help them reduce that aerosolization and create that protection level that they're looking for.
I would say absolutely. And I would also say dentists, a lot of times, their assistant could be turning over a room, taking x-rays, a cone beam scan. They may be having to do some of this work sometimes on their own. Again, it's a fourth hand when the fourth hand isn't there. Love that too. That was, So, okay. Everybody's always got some tips and tricks or helpful hints. Can you give me 3 or 4 before I say bye-bye to you? Yes,
absolutely. Love to. So first off, with the HVE lines themselves, if they have not been used in a while, so again, we've been using in the hygiene ops saliva ejectors only for a long time. So sometimes those HVE lines don't get run at the end of the day with our suction cleaner. So they've been kind of sitting there with some gunk building up in them, right? So my recommendation is to go ahead and run at least 1 or 2 cycles of that suction cleaner through that existing line that you have before placing your HVE in working order. And what that will do, it will clean out that line so you are getting the actual suction level that you are running to. And after you do that, I would go ahead and look at your suction trap because if there is a lot of gunk in that line, then it's going to gunk up your suction trap, right? So you want to make sure that the suction trap is go ahead and, again, because that's just going to reduce your suction level. And then a hygienist is like, it's just not doing what I wanted it to. So make sure that those 2 things are kind of done before putting this into place. And in regards to the actual suction level itself, remember, this is for aerosol reduction. So I, as a hygienist, was still going to go ahead and put that saliva ejector in place, hook it and put it in the cheek, just like we had before, because that's still going to help with moisture control. So again, if we're working maxillary and we've got saliva and we've got, water pooling, that's where that saliva ejector is going to come into place. Okay. So we still want to go ahead and use that saliva ejector as a second level. The other thing that I would say is the mirror head itself, just like any other mirror that you put into practice, go ahead and take a fine Profi paste or a medium Profi paste and roughen up that surface on the mirror itself, just to kind of release that surface tension, to help with any kind of like water droplets and things like that might stick to that mirror. And you only need to do that once when it first comes in, and then you should be good to go. But it's just like any other mirror, that always helps.
Great tip. Well, I just know one thing. I bet with COVID now, this item from Dentsply, Purevac, this is going to be a hot item. There is no doubt about it.
Absolutely.
Yeah. So just beware of that as we're trying to get these into our offices, everybody.
Yeah, please do. And I will say, just like any other PPE, we're having, every manufacturer is having some supply issues. And I will say some of the supply issues are coming from on the dental side, is that a lot of manufacturing sites are not able to, to work at their fullest capacity because of different state regulations. Like they're being put on, furlough and things like that because dentists were not considered essential. So dental manufacturing was not considered essential. So we're working as fast as we can. And these are actually manufactured right in York, Pennsylvania. So they are coming from a USA, facility, which is always a nice note there. So I would say also the quicker that you order it, the faster, because it is first come, first serve. So the quicker that you get the orders in, the quicker that you will get that item back as soon as they are in stock.
Thank you.
Sure.
Thanks so much. Thanks for being here.
No, thanks for
This
having us
is
on and looking and talking about Purevac HVE. It's a wonderful product, and I think that it's going to be a huge game changer as far as the protection level, and we really hope that it's going to help out with the hygiene mindset going back to work.
Thank you. This is Dr. Lou Graham. Thanks for joining us at the New Norm. Be safe, just be safe out there. Thanks. So let me be clear. We want to hear from you. We want to hear your questions. So what we want you to do is we want you to go to education@midwaydental.com. Shoot us your questions. We'll go right to the experts. I know I'm not the expert, so let's go ask the experts what we should be doing as our next step next week, the week after, and thereafter. I look forward to hearing from you.